Hello and welcome everyone to our Ask Muneeza today. It's a special edition with dental health Q&A because so many people are asking me about dental health, asking me about their oral health, their gums, their teeth, their bad breath, sores in the mouth, pain in the gums, um, plaque buildup, and how to avoid all of those things. So it's really helpful for us to be able to do a chat about this topic because so many of us struggle with it. So many of you posted a bunch of comments on my Instagram page. So I'm going to pull up those comments and read out those questions because there were so many of them. All right, so let's get into it. So the first question that I got was my 2-year-old has cavities. Should I take him to the dentist? So Sina says, my 2-year-old has cavities. What I would say, Sina, is that if your 2-year-old has cavities, you want to start giving your 2-year-old, you know, some celery juice and getting your 2-year-old to learn how to swish with celery juice. And yes, you should take him to the dentist, get them looked at, because you want to see whether the cavities are small or they're deep and big. And you want to make sure that the dentist can look in parts of the mouth where you cannot see. So that's what I recommend. If you are just joining me on YouTube or Facebook, come on here, leave me a comment, ask a question. So Andrea Rentz says, what kind of um, tongue scraper do you recommend? I recommend a plastic tongue scraper. You could use wooden, but I know someone who once got a splinter in their tongue because of a wooden one. So I recommend a plastic one for that reason. There's no point getting yourself all, in a bind with a wooden one. But yeah, a plastic one tends to work really well and you scrape. And so this question's been coming up a lot on this morning on my Instagram when I was doing Q&A for dental health issues, and lots and lots and lots and lots and lots of people have written to me asking, do you brush before or after celery juice? So I actually looked up what Medical Medium says about this in the celery juice book. And he says in there that it's most important, if you are going to brush your teeth, to do it after celery juice. That's the preference. Because if you do it, he says right here, I'm going to read it out to you. It is a good idea to commit 16 ounces as a minimum because most people have a few health obstacles to overcome. The celery juice has to travel quite a distance on its journey. The first obstacle is in the mouth with bacteria, leftover toothpaste, mouthwash, or mouth rinse. Make sure you thoroughly rinse your mouth with fresh water after brushing your teeth and before drinking celery juice to get rid of any toothpaste, mouthwash, or mouth rinse residue. Even better, wait to brush your teeth until after you've had your morning celery juice. So that's the recommendation. And I wanted to clarify that because so many people had a confusion about it. So next up is Tiptoe Healing. Tiptoe Healing says, what water filter do you suggest for teeth? Is it the Burrow or the Berkey Phoenix filters or RO? For now, I think the safest thing to go with is RO because you know that RO removes everything from the water. So that's where I would land. Medical Medium Mama says, please explain your protocol for daily brushing. When do you do it and what products do you use? So for daily brushing, I first tongue scrape, then I drink my drinks, then I brush my teeth, and then I'll floss at the end of the day before I go to bed. And then I brush again, obviously, before I go to bed. I sometimes use a mouthwash. I don't often need that. But I do like to swish the peroxide in between my teeth. It helps with whitening and things like that. So that's my daily routine. It's pretty simple. It's not complicated. Should we be going to the dentist every 6 months for checkups? If you have issues with your teeth, then yes, I would go. But if you don't and your teeth are pretty good, then you can wait longer in between checkups. Vasilika says, when is the time to better refer to a dentist with cavities? Well, you always want to get them checked, no matter where you are with the cavity situation. Go and just get them checked. You don't have to get them filled, but you have to get them checked. The reason is the dentist will be able to see if a cavity is really deep and it needs filling. And if it's a deep cavity, I would recommend getting it filled. But if it's a small cavity and it's not gone past the dentin, the yellow part of the tooth, then you can work on it with medical medium protocols, celery juice, and etc. You can actually make a big difference with that. So how do you differentiate from teeth pain from shingles or cavities under the crowns? It's hard to know unless you've had an issue before. Sometimes you can tell. The one thing that will make the biggest difference to tell is do an x-ray and see if there's an infection or an abscess. If there isn't one, then the pain is likely viral. Likely, but not always. Because it could be a pain from the crown itself and the way it's sitting on the tooth. What are the dark spots in kids' teeth and how to fix them? Often brown spots can come from heavy metal oxidation, but they can also come from enamel weakening and staining happening. So actually you stain when your enamel becomes weaker. Perone NYC says, my front teeth are losing a lot of enamel and chipping all of a sudden. Well, it's not happening all of a sudden. This has been building up for years and years and years. So start doing daily spinach soup. This is my spinach soup I made in the morning. So I'm going to finish it for today. And then you can bring in some extra greens in terms of brain shots. My brain shot that I'm having for today is my cravings shifter shot. So you can do that. You can bring in more celery juice multiple times a day. Swish with celery juice multiple times a day. That is also super helpful. Cheryl says, on for 7 years, got a black tongue in September. Now it's more brown and has gone away and come back. How do you get rid of it for good? Keep doing heavy metal detox smoothies and it will finally go away for good. Keep doing them, Cheryl. You're on the right track. Okay, next question is from KK. And KK says, if a toddler's tooth enamel is damaged, how can we rebuild? Celery juice, mineral salts from greens, cucumbers, limes, lemons, oranges, bring in magnesium, silica, things like that can be super helpful. You guys, if you're interested, when we opened the dental program for the first time last year, so many people joined us. So many. So I'm just saying, it's open again. It's open only until tomorrow. So given that people are asking me so much about it, I decided to come on live because I normally don't come on live like this, but so many people have so many questions they want me to answer. And we're actually, lots of these questions are answered in the program. And if you want to know more about it, I can tell you, we have 5 dental guests. One of them is Nadine Artemis of Living Libations. She talks to you about what really you need to do to keep your saliva healthy, right? It's a really interesting conversation on saliva and what you can do to help your teeth get stronger and how her products can really help because she has some of the best dental products in the world. And then we have a dentist who is an airway specialist. We have 2 general dentists sharing information and who are who are interviewed in the program. And then we have an orofacial dentist specialist. You cannot get, and they're all friendly dentists. So the program has so much packed information that I wouldn't be able to share enough with you here, but there's so much over there. So definitely check it out. Tap the link and you can join. All right. So we also have a payment plan for those who need that. So Health Anali says, how many minutes to wait in between drinking celery juice, brushing teeth, HMDS? So you can brush your teeth 15 minutes after celery juice. That's what I recommend. Can I brush my teeth after making HMDS? Yes, you can. Yoga Hurt says I have a white coating on the tongue despite and teeth marks on the sides of the tongue. That means your tongue is likely enlarged because of a liver issue and too many toxins which is why you have teeth marks on the side of the tongue. And white coating on the tongue is coming from the gut. It's like so many people this morning. I mean, literally, I think there's over 500 questions about dental health. I have not been able to get to all of them, which is why I decided to come live. And so many of you have questions that I thought the program would be so supportive, because you all have so many questions about dental health. I mean, it's probably one of the most popular topics there is, because so many people have issues. So the white coating on the tongue is coming from your gut, right? It's from the gut. You have to take care of the gut. It's likely like deeper acidity, biofilm, acidic matter that is coming up and coating the tongue, including strep bacteria and other bacteria pathogens that are in the gut. Elaine says, I signed up for your fall dental program. Is this different? No, it's not different. It's the same. Okay, so Elaine also asks, I just had a root canal. Doctor didn't prescribe an antibiotic. He said it was up to me. What can act as a natural antibiotic? Garlic and golden seal. Good question. In case of poor gut health, is it better to chew a salad, smoothie, or a juice? Smoothie or juice is probably best. Lauren says, when I swish celery juice through the day, wait 15 minutes before eating and drinking each time. Can you swish right after eating and drinking? I would wait like a few minutes. It doesn't have to be 15, but you should wait like 5 minutes or so before swishing. Veronica says, years of tooth pain and throbbing. It started after biting into a hard nut. Now it only hurts. If it's years of this pain and you have had yourself checked for an infection and there isn't an infection, then I would say this is viral. It's a viral injury to that nerve. And you can do a lot of the living libations tools like Yogi Tooth Serum, ozonated gum gel, propolis, lysine, things like that can be super helpful to calm that inflammation down. Does steeping herbal tea in hot water take away its healing benefits? You just don't want to overboil it. So if you do that, it can take away some of the benefits. But if you don't overboil it, then that's fine. I mean, you can boil the water. I let it always cool down just a little bit, and then I add it so that it's not boiling hot. Okay, our next question is, do you have a recommendation for a dentist in Massachusetts or New England? I'm willing to travel. I've been too nervous to go to a dentist since starting MM 6.5 years ago. If I were you, if you want to travel, I don't know anyone in Massachusetts, but I know a dentist. I know 2 dentists in New England. One is, and they're both on the dental program. Dr. Anna Covin in New York, and Dr. Artani in New Jersey. So they're both excellent if you want to check them out. Okay, our next question is from a brown-eyed girl. Is choosing a dentist who uses a laser for dental decay a good idea? I think a laser is perfectly fine to use for decay. Eat, Care, Heal says, which silica do you recommend, G5, G7, or plant-based or mineral-based? There are 2 types. I recommend both. Both are great. I think you get a little bit more out of the herbal one, but both are great. How to heal the gut to restore teeth. Well, I cover this in my gut and dental masterclass, which is, by the way, included in the dental workshop. It's included as a bonus. So you have a whole program on gut health as well. So heal the gut, starting with celery juice, doing a mono-eating cleanse. Those are my top 2 recommendations to work with gut healing. Mary says, brush teeth before lemon water or after full morning cleanse, or both? See, this question came up yet again. You want to brush your teeth anytime after celery juice. Okay, anytime after celery juice. Not before celery juice. That is the medical medium preference. Okay, next question is Yvonne is asking, why do gums bleed? Why do gums bleed? Gums bleed because there's either nerve weakness in the gum line or tissue weakness because of poisons, because of pathogens. There isn't enough nutrition in the nerves, in the gums, in the teeth. That can create weakness as well. So there's many reasons why gums can bleed. One way to strengthen gums is to start doing celery juice and swishing with celery juice in your mouth. That will strengthen your gums. Another thing is to take a soft velvet brush, the ones you can get from Living Libations, and gently massage the gums. That will strengthen the tissue of the gums and reduce the instance of bleeding. So if you're bleeding a lot, you have to look at gut and liver protocols, because at the very root, why it happens is because it's, gut stuff's going on, and that stuff's going on. It's really a lot. Okay, Sarah Burton, good to see you here. How are you doing, my love? Can getting 5 dental x-rays cause a flare or sensitivity to the sun? So I feel a swaying feeling harder in the nervous system. For sure. 5 dental x-rays can lower immunity and have the viruses play more havoc in your system, right? So yeah, I think that it definitely causes an issue, more of an issue. So yeah, are you doing the radiation exposure shot? Are you doing extra heavy metal detox, like the advanced heavy metal detox smoothie? All of those would make a difference in your case, I feel. How would you recommend using garlic and golden seal? Eat or juice the garlic? Well, you can use it in many forms. You can do medical mediums garlic shock therapy or garlic therapy. You can mash garlic in either honey, raw honey, a steamed potato, an avocado, or a banana. There's 4 ways to do garlic therapy by medical medium. You can do garlic that's included in the pathogen exposure shot. You can do garlic that's included in the turmeric ginger shot. So you can do a mix of them. And then for golden seal, I wouldn't juice it. It's harder to find whole golden seal. It's kind of like ginger. But I would instead just do the tincture. That would probably be the best way. Sarah says for the radiation, you're doing all of it. Well, then if your nerves are getting sensitive to the sun and the heat, I would do more nerve support. I would bring in more B12, like B12 shock therapy. I would bring in 5-MTHF, B complex. I would bring in EPA, DHA. I would bring in propolis, curcumin, magnesium glycinate, the California poppy. All of those will sort of calm that sensitivity down. Okay. Shan, nice to see you here. Walaikum salam. I've suddenly got bad nausea and a lack of appetite. Is that a new bug? Many people are getting this bug. It's a sort of a stomach bug that's happening. Lots of people are getting this bug. It's really intense right now. So yes, I'm very likely it could be. Do some ginger, do some oil of oregano, and maybe some pathogen exposure shots can help. I know it sounds like with nausea it's hard to do, but seriously will make a difference if you bring it in. Yeah. So I hope you feel better. Summer is here. I love that handle because I would say it even in the winter just to make me feel better. So we wake up, rinse the mouth with normal water, then celery juice, then brushing. Thank you. Yeah, you could do that. I mean, you could do wake up, scrape your tongue, because that's where a lot of the bacteria collects. Scrape your tongue, have your lemon water, wait 15 minutes, 20 minutes, have your celery juice, wait 15, 20 minutes, brush your teeth. That is what I recommend because that is the easiest way to help. Okay, our next question is from Sandra Wan. Hi, Sandra. Nice to see you here. Should I let my dentist remove my last tooth that is missing a lot of enamel, or do you think it can heal? I would have to see it, honey, to see how eroded it is. But sometimes it's really eroded, and then it's hard to be able to, pick it back up. But If it's not super eroded, if it's not super eroded, then you can definitely fix it and heal it using medical medium tools. Um, have you switched with celery juice? Have you done enough of that? If I were you, I would definitely check that out. For those of you who are just joining, the dental program is live. It's only available until tomorrow. So many people have asked me about it, so I've made it available. Please check it out. Tap the QR code and you can join the program and get so much information about dental health. I mean, the dentists who are in the program, they knocked it out of the park. So I hope you'll watch it. Andrea Placatus, hello. So nice to see you here. My upper, you said morals, but I think you mean molars, are turning inwards towards the roof of my mouth. I'm guessing it's stress related. Shingles, they don't hurt. My bite is just not perfect. It could be stress related, but my guess is that it's also due to heavy metals and heavy metal exposures. So I would do lots more heavy metal stuff, but I would work on, I don't know how many supplements you're taking for your viral issues. I would do a lot more than you are probably doing right now. Because if something is pushing your teeth upwards, that means there's something that's actually moving them. Either the shape of your mouth is changing or there is a viral element included. So I would do both heavy metal detox and the viral pieces as well. I hope that helps, Andrea. Next question is from Astrid 144. She says, my dentist claims that his x-ray machine is safe with reduced radiation and even remains in the room while taking the x-ray. Can I trust this? I personally would not, but I don't know him and I don't know the research, but I'm very, very skeptical when it comes to such claims. I would have to really get that verified. Sandra says, thank you. I swish and use living libations every day for 2 to 3 months back, but increase your level of greens if you want to remineralize your teeth. Such a mouthful to say that. Okay, so lots and lots of great questions. How many of you have questions about the actual program? Do you know what you are going to get? I know a lot of people sometimes wonder what they're going to get in the program. So I can share with you. Let me see if I can share my screen here. Yeah, it's giving me an option to share my screen. So let's try to do that. And let me show you what's in the program. Meanwhile, keep your questions coming. I'm happy to answer them. Okay. Let's see. It gives me the option to share my screen. Just give me a moment. Okay. Okay. Let's see if this works. Trying one more time. Yeah, it's not allowing me to do it right now. Anyway, I will share with you. So in the program, you get recorded calls. We cover the topics, lots of topics that we cover. Let me pull it up. Okay, so TMJ, cold sores, canker sores, jaw pain, gum disease, plaque, sore throats, root canals, implants, orthodontics, tongue ties, mouth breathing, snoring, sleep apnea. These are all the topics that we have covered in the program. And there's more. I mean, I'm not even sharing all of them with you right now. We even cover Andrea Placatus. There's a whole section on Invisalign, the dentist who talks about airways. She is an Invisalign specialist, and there were many questions about that in the program as well. So there's lots of Q&As. So we have bonuses as well. So you're getting the gut and dental health masterclass included. You get the cleanse your liver to heal chronic illness, which also helps to heal the liver, which is such a big part of healing the gut, which is such a big part of taking care of your teeth. So I explain the connection between the gut, the liver, and the teeth. And so you get these 2 bonus classes that will help you a lot. And then you get 2 recordings from Nadine Artemis from Living Libations, where she talks about oral care and skin care. Her interviews are just mind blowing and amazing. So that's also included in the program. There's a lot of, so we have 5 guest speakers who are sharing in addition to the teaching calls and the Q&A calls. So you have teaching calls, which are pre-recorded, Q&A calls that we've already done, and then interviews with 5 guest speakers. And they also are teaching and answering your questions. So we have an airway specialist. We have Nadine Artemis from Living Libations, Dr. Ellen Bass, orofacial pain and oral medicine, Dr. Cornell, who's a general dentist, and Dr. Cavan, who's also a general dentist. I hope you'll check them out. The program is here for you. If you have any questions, please, please, please ask me. And you get to keep the program for life. A lot of people ask me that question too. All right, some more questions coming up. Kathleen says, can you tell me why one pupil is bigger than the other one? Unfortunately, honey, I cannot tell you that. It sounds like it's viral, but I'm not sure. Andrea says, my son wants Invisalign, but the biological dentist said he cannot until he has surgery. His canine and baby teeth never came out, and it's buried in his upper gum, which is causing issues for other teeth. Should I do this for him? You know what I would suggest, Andrea? Contact Dr. Artani, who is the airway specialist and the Invisalign specialist, and actually have a consult with her and ask her the question. I would trust what she says. She's a very good dentist, and she's very respected. I mean, and her work is excellent. So I would check that out. Kathleen says, can you tell me why I have a severe dry mouth? 2 things. It's viral, and it's also related to very weakened adrenals. Viral and adrenal. All right. Andrea, on the portal? No, not on the portal. You'd have to reach out to Dr. Artani and do a consult with her. So if you want to know about her office, please email us and we'll send you her office information. But yeah, absolutely happy to help with that. Okay, so we had another question come through about removing wisdom teeth, and I would say don't remove them unless you have a problem with them. Don't just automatically go and remove all your teeth. Sandra says, I also have withdrawn gums and I'm scared of it. How long can it withdraw? So you mean recessive gums? Can it go away totally? Yes. I'm on mono eating, so I'm working on the problem. Yes, so recessive gums come from having too much gut acidity. And when that comes, it can help cause the gums to recede. So you have to resolve gut acidity by doing a mono cleanse, bringing in aloe. Aloe is really helpful. Parsley shots are really helpful. So I would bring in all of those modalities to help you heal from those issues. Yeah, that's all I have time for today for your questions. They were great questions. I hope you'll go back and listen to the live again. And thank you for being here. Check out the dental health program. It's only available until tomorrow, and hopefully we'll be able to get you the support that you need to resolve your teeth issues, because so many people, chronic illness ravages our bodies. Skin, hair, nails, bones, teeth are all affected by chronic illness. So that's why we have to take extra special care of this part of our bodies.